Hello, I am Lisa Obradovic and would like to welcome you to the podcast Certification Inspiration, produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as WOCN-CB. Founded in 1978, WOCN-CB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. We are launching the Certification Inspiration podcast with a series of episodes that will discuss the different roles of a WOCN-CB certified nurse, nurses sharing their own experiences. In this episode, you will hear from Holly Hovan. Holly is a wound care coordinator at the Department of Veterans Affairs Medical Center in Cleveland, Ohio. She has a passion for education, teaching, and our veterans. Holly has been practicing in wound care nursing for approximately 6 years, is currently serving on the WOCN-CB Board of Directors. In addition, Holly is a wound source blogger. In this episode, Holly will discuss a day in the life of a WOCN-CB nurse in a long-term care facility.
A day in the life of a long-term care CWOCN. Hi, thanks for joining me. My name is Holly Hovan, and I am an advanced practice registered nurse at the VA Northeast Ohio Healthcare System, proudly serving those who have served. I cover over 230 inpatient beds and nursing staff as a WOC educator. I cover mainly the long-term care section of our facility, along with acute inpatient psych, line rehab, inpatient dementia care, transitional care, inpatient hospice, and inpatient psychosocial rehab and recovery. I provide coverage as needed to our outpatient clinics, acute care beds, and spinal cord injury. The majority of my day is spent with the long-term care and geriatric population. I have a passion for education, teaching, and our veterans. I have been practicing in WOC nursing for the last 6 years. I've been an RN for 11 years total, and more recently an APRN for the past 5 years. I am tri-certified, meaning that I hold certification in wound, ostomy, and continence care. I practice full scope in my current role, meaning I see patients who need all of those things. I have much experience with the long-term care population and chronic wounds, as well as pressure injuries, diabetic ulcers, venous and arterial wounds, surgical wounds, radiation dermatitis, and wounds requiring advanced wound therapy for healing. I also manage patients with urinary and fecal incontinence and those who need urinary and fecal diversions. Containment is also something that patients may need at times depending on the level of incontinence, so I do work with patients on that as well. We have bowel and bladder retraining at our facility along with great restorative nurses who come up with an individualized plan of care to restore each patient to their highest level of functioning in terms of managing their bowels and bladders. I manage patients with complex ostomies, fistulas, and tubes and drains. I see patients in the preoperative period, postoperatively, and coordinate homegoing care along with home care nursing and supplies for WOC patients. I really enjoy teaching new nurses about WOC care, especially ostomy management, preventing skin breakdown from incontinence, and pressure injury prevention. I enjoy working with each patient to come up with individualized plans of care based on their needs and medical situation. I value the importance of taking an interprofessional approach with WOC care and prevention overall, and involving each member of the healthcare team as they all have something to offer to our group. Lastly, I value the significance of the supportive leadership within my facility and the overall impact of great teamwork for positive outcomes. So, that leads us to what is a CWOCN and how does this relate to long-term care? Just a brief overview of long-term care where I work. It is called a community living center. So what is the community living center? It's a little bit unique to the VA. It's our long-term care section of the hospital. It used to be called a nursing home. So we want to provide a home-like environment. There's lots of activities for the veterans to participate in. There's PT and OT. Family members can come and visit. There's trips for them to go on, activities. The mission of a community living center is to restore each veteran to his or her highest level of well-being. It is also to prevent a decline in health and provide comfort at the end of life, which is one of the things we do in our inpatient hospice unit that I cover. So something else unique about this long-term care setting is that it is actually connected to our acute care hospital. So it allows for easily transitioning between the two if a patient would require a higher level of care. So, um, so what do I do in a day? So triaging the day is basically where it starts. We work Monday through Friday, so I'll come in and much like a nurse on the floor would triage her patients who needs what first, I come in and I check my EMR, I check my alerts on the computer, emails, voicemails, touch base with my coworkers, my colleagues, follow up with anyone from the day before that may have left a message. So I triage the day. What's most important? What can wait? What needs to be done first. Maybe there's an urgent issue, a patient that needs marked for an ostomy surgery that may have came in late, or it's an emergent thing. So take care of that first and then kind of just plan the day from there. I do conduct weekly rounds. So on each of the long-term care units that I cover, I go there in the morning. There's a designated day, Monday through Friday, 5 units, one per day, and we conduct rounds with the interprofessional team. So we'll meet in the morning for a huddle, and then we determine which patients need to be seen. After that huddle, we discuss weights, any issues with incontinence, any specialty bed or seating surfaces, any ostomy issues, any issues with nursing or education or anything like that. And then we'll execute a plan and we go out and we see the patients. And then since I have advanced practice, I can update those orders in the chart, write any new orders, and then do my documentation after that. So that's a typical morning is my rounds. And then throughout the day, I do things such as preoperative stoma site marking, post-op education. We do rod removals for the stoma rod, family education, help with challenging negative pressure wound therapy dressings, recommend advanced wound modalities. We also have a telehealth department in our spinal cord injury section. So for those patients that can't make it to the hospital or live far away, they can be seen via wound telehealth, which is pretty neat. So some of the other things I do throughout the day, a lot of collaborating with different services. So we have lots of different services, vascular, podiatry, general surgery, ENT, plastic surgery. We have an amputee clinic. So I'm constantly collaborating with them just to make sure everything is in place and the patients are getting what they need and that they're following up with all the appropriate services. So we serve as a consultant to the patients and then an educator to the staff. So wound, ostomy, incontinence care, I see surgical, vascular, diabetic, neuropathic wounds, pressure injuries, wounds requiring negative pressure, and then just different kinds of surgical wounds, things that may have delayed healing or amputations and things of that nature. So I have a knowledge of radiation dermatitis as well. Unfortunately, we do see that sometimes. We do a lot of topical treatment of that and then education for pre and post radiation therapy, just things to keep your skin from breaking down during radiation. Education is a big piece of a role of the CWOCN. We are educating patients and families and nursing staff, and we are educating on all kinds of different topics. So from ostomy care to pressure injury prevention to changing a surgical wound dressing to hand washing to preventing pressure injuries, just lots of things. We're constantly educating to promote better outcomes for our patients. So that's really important. I also lead weekly interprofessional wound meetings with quality and leadership. So we discuss incidence, prevalence, different things we could do for education, and anything surrounding WOC nursing. And I participate in hospital-wide wound care committee meetings. So we meet quarterly as a hospital, acute and long-term care, and we just discuss what's happening in each area. And as an APRN, I'm writing orders and coordinating care between different services, as I mentioned before, and then also participating and leading prevalence rounds in the hospital. We do those quarterly, so that's kind of important to report our QI and PI measures. And then orientation of new employees to WOC nursing care, because they get stuff in new employee orientation and, they get stuff in nursing school, but sometimes there's just a little bit more in-depth things, that the WOC nurse can educate new employees on. So that's important. So just giving you kind of an overview of my day. There's a lot of things that go on in a day, and there's a lot of patients that we see, and there's things, are constantly changing, and we might have to re-triage our plan and just change things up. And that's okay, because I'm always learning, I'm always teaching people, and I really, really love what I do. So WOC nursing, just to recap, we have so many roles, so many possibilities, and so many opportunities to improve a patient's outcome and overall experience. We touch lives every single day, and we get to see the impact of our hard work, usually in direct patient outcomes. So we really have the capability to take something negative and turn it into something positive. So whether it be a patient who came in, was very sick, on a ventilator, and now they're walking out the door independently, managing their ostomy, coming back a couple of months later to say thank you. Or seeing a patient admitted with a stage 4 pressure injury, now walking out the door with just a scar because their wound healed while they were with us. Or helping a patient to determine the etiology and treatment plan for their incontinence and helping to increase their quality of life. Or seeing someone's cancer go into remission after a surgery that they were apprehensive about to create a fecal or urinary diversion. Or seeing a patient that has both a fecal and a urinary diversion after a huge abdominal surgery, who's managing both of them independently, walking out of the hospital, and their cancer is in remission. So it takes the village. That's something important to remember. So we're always working as a team. We're a part of the team. We have providers and surgeons, physical therapy, occupational therapy, dietitians, all different specialty services, leadership. We're all working together to promote positive outcomes for our patients, and we get to see this each and every day in our work. So we see the value of what we put into things, and every day we touch a life, or a patient touches our life. We have the potential to make something negative something positive. We do it for our patients and for our facilities, and we teach students so that we can grow our profession as WOC nurses.
Thank you for listening. WOCN-CB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more, or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.